All right. Thank you, everybody, for joining us. This is Monarch Family Chiropractic Spinal Workshop on joint health with nutrition and supplementation recommendations. I'm Dr. Kristen. Welcome to learning. We're going to get started on talking about our joints, talking about their health, the value that brings us. There we go. And some nutrition recommendations, just some things that also are good to be aware of that affect your joint health and a joint mobility. And I'm going to cover a few things that I use supplementation wise. I'll cover things that are out there in mainstream that you hear everybody talking about. I use different things and love the results I get from them. So I wanted to share that with you as some alternatives. So when we look at factors of a healthy joint, I don't know if the types of joints showed up there very clear, but the joint is the connection between the two bones. So joints and their surrounding structures are going to allow you to bend. So all the joints we know of, right? Elbows and knees and hips, and the way in which we bend our back, the way in which we turn our head. These are all different types, those 6 different types of joints that our body has in different makeup in different areas in order to do those motions and those rotations. I mean, even everything from how our fingers move to wave. So a joint has different mobility based on where it is in the body and its connecting parts and pieces. So you hear a lot of people understand that they've got a lot of, we've got cartilage that is the tissue in between the joints. We've got the synovium, and then the synovial fluid, which is the lubricant that is cushioning the joints so that the bones don't rub and touch each other. So they help create space, if you will, but really keep that lubrication so that things glide like they're supposed to. Obviously, in all the workshops that we do about curves, you understand that you lose that space and you can lose that fluid then, which all those topics and reasons why are covered in different workshops that are along the spinal hygiene and those healthy curves. So if you're wanting to understand more information about that, and this is one of the first workshops you're tuning into, then I highly suggest you look at the calendar and look at when we're talking more about why those curves matter. Or there is lots of workshops recorded and saved on our YouTube channel that talk about when we take it further than the parts and pieces of the joint, why the curves have value and why that changes the joint's mobility. So we're not covering that in tonight's workshop. We're talking more about other things in the joint that create health and create you supporting mobility and movement in that health. So best way that we're caring for our joints is really to keep things like your joints, but also the muscles and ligaments and the bones strong and stable. So just one component, there's multitude layers. And again, many factors that wear and tear on the cartilage that leads to the reaction that we tend to see with the damage to a joint, which can be sprains and strains or tears in ligaments, in cartilage, in the meniscus. And then ultimately that leads to arthritis when you don't have those proper spaces and joint mobility. And again, we cover a lot of those details as to what that does and why in our curve workshops. So tips for joint health. We're going to cover through a handful of them, and hopefully none of these are big surprises to you, but there's a component of how a lot of these come together that are really valuable. So it is important that we have less weight upon our structure that will create more stress upon a joint if we're not in a healthy range. Having movement or exercise is really important, but I would say low impact for, again, joint movement and mobility. It doesn't need necessarily more compounding or compression like what running does or impact sports that way. So I listed some things like, walking, doing a very low intensive type of step aerobic class, swimming with that lack of gravity, right? Being buoyant in the water. That's a great motion to do to get lots of good joint movement without the weight and impact pressure upon it. Bicycling, things like of that nature. And like you hear us say so many times in our workshops and in the office when people ask us, well, what move, what motion, what stretch, what exercise? It's like the next one, right? It's just continuing to change positions, and that there isn't necessarily one position, it's just getting into the next position. So what we do not want to see, what just destroys joint health really rapidly, that now there's lots of science to prove, because we have so many sedentary jobs, is people in that kind of couch motion, or the computer addicts, that is really creating a high risk for joint pain and then joint deterioration. So what we do to combat that, that's why you hear us tell you set alerts, set alarms for every 20 minutes, every 30 minutes, every hour minimum, on your phones, on your computers and laptops, in your calendar schedule, something that just alerts you to, hey, get up and move around for a minute or two, and then come back to it. Now, with so many people doing very remote jobs, they have more flexibility to almost do that. Half the time nobody sees them, or if they could be on a call or a screen, but they can, not be on the screen, or they're in a remote situation where they can get up and they're not sitting at a desk in an office where they feel uncomfortable about getting up and stretching for a minute. So that's something we encourage greatly. And if you are in a position or at a job where you do move, it's what kind of movements are you doing? Can we incorporate some new movements that we covered in the function and flexibility workshops this last month? Building muscle is really important in supporting joints and healthy joints. So I will put some information just talking about weight resistance, because it's really doesn't have to be a lot, and you don't have to have equipment. Weight resistance and just body even resistance. There was lots of different exercises or things I could put down here, but I didn't want to put real specifics depending on what someone can and can't do. I don't want someone to feel like, oh, well, I'm not building muscle because I can't do 20 push-ups, or there's just anything with weight resistance is still supporting bone and muscle density. And so if you're keeping muscle strong, you're in surrounding ligaments, then the joints don't have to do all the work. So it could be something with a light resistance band that you could attach to a doorknob and do light movements where you tie it around your ankle, and you just can do all sorts of low body hip and leg movements and core movements that you don't need a lot of equipment for. So we did a few workshops just recently about using your tools that you have at home. So just even things you can incorporate with simple things at home that you don't have to buy equipment for. But our chest, our back, and our abs are really the core components when you're looking at your core strength and your body, the joints being healthy of your low back, hips, knees, and shoulders. So the bigger joints in the body. Whoops. Other components would be knowing your limits, right? Knowing that there's certain things that we don't need to do or shouldn't do that can create more soreness or that can create more pain. So it's really looking at, there's a point to good soreness and pushing the body to do movements that it can do to get stronger, that create some soreness, but don't necessarily shouldn't create pain. So it's looking and knowing the difference, and watching what your limitations are, and not exceeding them to a point to create something that would be more damaging than helpful. And we talk about this so much in our office. So those of you on the line with us, or that are going to watch this, that have been patients, you understand how important your posture is. But we couldn't stress enough how it is the window to your spine and your spinal joints, and the movements of your shoulders, your hips, your knees, and your ankles, and how those all play an important role on the amount of pressure or stress upon your joints. So if those are in a more vertical line straight up and down from each other, from that side view picture, especially in your posture, then we know that your body is now supporting its weight evenly over itself for the most part, rather than distributing more to an area than need be, right? So if our head weight is forward from our shoulders, then not only does the back of our neck and our shoulders hurt, and the muscles are overly tight, and we have trigger points in there, and they feel very, very rigid, but the joints in the spine are rigid from being put stress upon them. That is usually double or triple the weight of our own head upon our shoulders. So same thing, the side to side picture that we're looking at is how lopsided are we, right? How much do we favor a side left or right? Thinking about that in just your day-to-day activities might be: a student, do you carry your backpack with both straps? Versus just hanging it over one shoulder and putting all that weight on one shoulder. Same with anyone carrying a purse or some type of bag. If it's a computer bag or something that's more like that type of a satchel, you want to wear it across the body. And we want to switch up what side we're wearing it on, but it's that we're putting it over our head and our strap is here and the bag is sitting on against our other hip. So adapting the strap so that it's not too long, And that we're, again, supporting more of the weight over the center of our frame versus the left or the right side. It's really important to avoid injury that we are protecting our joints. So I think about it from the physical aspect of things we do. Are we wearing helmets? Are we wearing our knee pads, our wrist guards, elbow? So depending on what your activity of or weekend warrior activity is, regardless, from our little kids up to, seniors, we just need to be protecting the joints. And for some of us, it's just maybe if we have more instability or an injury, or we know we may fall, are we wearing things that could support that? Even when I was semi-okay at snowboarding, way back in the day, I always wore my wrist guards because one bad fall and I can't do my job. So, I think it's just thinking about things in a sense of not injuring ourselves, let alone something like that could create a whole change in what you can actually physically do. There's lots of things that we could go into a whole other topic on, and we'll talk a little bit about it with supplementation and even foods. But reducing inflammation is key to the joints being healthy. And so keeping movement in them and that hydration being key, right? So yes, the joint is made with surrounded by that synovial fluid. So we just also need to make sure that our muscles, our joints, our ligaments, all of those components in our body are staying flexible and hydrated. So the muscles need hydrated, or there's a lot of different tension that comes upon those ligaments and where they attach to the joint. So we need hydration in the joint themselves, and how we do that is when you learn wobbling is a good example of things that we do to keep hydration in the discs, which is that fluidy area between the bones, as well as throughout the joints. Keep that fluid moving, right? We don't want that fluid staying stagnant and not pushing itself out and bringing in new clean fluid. It's intended to move and cycle through old to new, and just continue to regenerate healthy cell tissue and joint function and fluid. So hydrating is key in multiple ways. But even elevating and icing and topicals that you can use, those are all things that help with joint inflammation. And then we talk about just really nourishing through food and supplements. So, vitamin D is really helpful in absorbing calcium, so keeping that bone density and health. Just another, oranges are really great with vitamin C and antioxidants, things that are really driven along the lines of decreasing inflammation, which is really what helps your joint be calm. And I thought I'd throw this in there because I don't think we've covered it or talked about it in quite a long time. And so if you've ever heard of the Dirty Dozen or the Clean 15, I thought this would be a good time as we get into, it's all the fruit and the vegetables are in season now more. And I think for some of us, it's easier to eat them this time of the year than at other times of the year. I feel like there's more options and variety, and it's less challenging sometimes to figure out what to do with them or to make something different and new. So I think it's really pertinent to realize that things that even can seem healthy create inflammation in our system when they're treated with pesticides or processed in other ways that actually create sometimes more harm than good. So when we look at the Dirty Dozen, that's talking about the components there that are most contaminated foods that we eat in the United States, at least, and the way in which we process things and produce here. So it's really watching that you're buying organic. And I think that it's also looking at number one being the most down to 12. So apples, celery, strawberries. Apples and strawberries is just, I would say hands down, never eat if it's not organic. There is so much more stuff that you're putting into your body that's worse for you. That they literally say there's just in these especially this top 5, you really should not be buying them if you don't know how they're being treated. Let's put it that way. With the types of chemicals that are put on and sprayed onto our foods. So things like peaches, even nectarines, grapes. So it's watching where some things come from, potatoes, blueberries, lettuce, and kale, and some of the other collard greens. The things that are clean to eat and have the least contaminants would be, sorry, let me get that off my screen. Onions, corn, pineapples, avocado, asparagus, sweet peas, mangoes, right? Eggplant, some cantaloupes, kiwi and cabbage, watermelon, sweet potatoes, grapefruits, mushrooms. And again, looking at how they're sourced, where they're coming from, and if you're buying other things, that you're at least cleaning off as much as you can at home before ingesting them. But I think these are just good things to see. One thing I meant to put on the slide here and I forgot to add is I think it's nice to just also look at just type in low glycemic index. It's also just nice to see what fruits and vegetables are the healthiest to not spike your blood sugar, that give you really good nutrients, but don't mess with your sugar levels. So that can be very valuable when someone's doing a lot of things, because what does sugar do? Creates inflammation. It spikes things in our body, and it just creates inflammation that makes our body work so much harder than it needs to. So working off of a low glycemic index could be a good way to just see what shows up on that chart for fruits and vegetables, and picking some things off of there, one or two that you haven't had in a while. Some of our nutritional workshops that Doc has done really target on how we have to have that variety, right? And how we have to change that up so that internally we're getting a lot of good nutrients from different facets and in different ways. So if that's something that is of interest to you, or you're like, I'm not sure, or if I eat a lot of these things, I need some other ideas of things that need to round out my diet, that might be a great place to go, as to some of our microbiome and nutritional workshops based on those types of foods and things to add in for a healthy microbiome. So these are ones that are pretty typical that I feel like people hear of, which would be things like glucosamine and chondroitin, that is supporting joint health. The chondroitin sulfate is really more for the cartilage. MSM is one that's heavily talked about as well, supporting joint function. Things like turmeric and curcumin, those are very anti-inflammatory. So that's really good for joints and for our overall body inflammation health. And fish oils. I think that hopefully none of those things are unfamiliar to anybody. But those omega-3s are really important for combating inflammation, which is then again, less inflammation in the joints, less inflammation in the body. The joints feel better, they function better. So it's all about keeping that lubrication and keeping those really good fatty acid chains in our dieted in our system for all kinds of reasons, but the joints included. I'm going to tap into a few things that I use here to round out our workshop. And I've been using supplements through Arenda International for, I think it's going on 12 or 13 years now. And Ease and Immune are two that I think hands down are phenomenal at the end goal, which is decreasing inflammation and supporting the internal health of the body to function the way it's supposed to. So it's ridding of a lot of toxins, and it's helping balance things where there becomes imbalance. So Ease, which is the pre and probiotic, as well as the 31 digestive enzymes that our system needs, is really, really valuable, I think, in so many ways. But again, when we know that 60%, 70% of our immune system lies in our gut and lies in our digestive system, we know we need to support that. We need to have less inflammation in our whole systemic area and not just joints. But again, when we start feeling things in joints, there's a buildup most of the time, is what, other than an injury where you're bringing inflammation to the joint to heal the body, and it's doing its purpose to be inflamed and swollen, right? So outside of that, I think that when I see a lot of inflammation in the system with people, or they're complaining about the way different joints feel, I think there's just bigger levels of inflammation going on in the system at a systemic level. And so when you're incorporating something with Ease, I mean, a lot of times it comes up in conversation because somebody's talking about their digestive health or their gut, which is huge. And it's also just supporting decrease inflammation and a good balance in that microbiome and in the gut. So what's different about this is that it's all encapsulated into one. So most people are taking usually some kind of probiotic individually, and they're taking a lot of parts per billion just because of several reasons I'll get into, but they're taking a fair amount. Also, the prebiotics, so some of the earlier part of the digestive system isn't getting as much attention, as well as many people have an enzyme issue to where their bodies don't have all the enzyme levels they need. And so it's hard for them to break foods down and digest things or absorb their nutrients, all of which can then just create inflammation in the gut. So what's different about this particular supplement with Arenda is that they have the systemic property means that they have it's enteric coated, meaning you're getting, in a sense, of protection around the prebiotics and probiotics and enzymes, so that when you take it, it's two things I feel like happen. You don't have to take as much because this is a very synergistic property to have three things working together at the same time. And so it doesn't need as much of each of those things individually. And if we can get things past the stomach acid, then we don't need to take as much of it. So a lot of people taking over-the-counter probiotics and certain enzymes, a lot of our stomach acid, the acidity is so high, it kills off so many of these good bacillus bacteria that we need to have good and balance the good bacteria in our gut. And so they're taking so much of stuff, just trying to get some amount down into the, small and large intestine to get absorbed and work for you. So I feel like most people love this and they get the good effects of it because it's getting where it needs to go into the body, and you're not killing off so much of what you're putting in by just the stomach acid at the very beginning. So I feel like it's just a really well-rounded thing to decrease inflammation and really support then less inflammation in the joints, is a nice side effect of that. The other one is a product called Immune, and it's really a detoxification type supplement at a very easy daily level. So it's not just targeting like liver, kidney type of a detox. It's at the cellular level. So the picture it's showing on the right there is gluconerization. And what this basically process is doing is when things build up in the body, I always think about when I see that little yellow cell, almost like a Pac-Man, and how I describe this process. And you can read more about that. You can take down things like the beta-1,3 glucans and look at what that is and how that decreases inflammation and supports things with joints, the mammopeptides, as well as the calcium deglucarate. Calcium deglucarate, a lot of people are finally getting that that's a big deal and very important property and putting into your body and supporting your body. But if you have toxins that are attaching at the cellular level with the things we eat, with the environmental things we breathe in, all the types of toxins that go into our system in just a day-to-day, especially living in the city like this, it's one of those things that we want to break up or cleave the bond of where toxins stick to the receptor sites. So if those receptor sites are covered, it's kind of like having a Pac-Man with a blindfolder on, and things are going past it, but it can't see it because the blindfold, the receptor site is blocked with a toxin or blocked by something, right, in the body. And so when we can break up, and what those properties do is break up or cleave that bond and take that toxin and break it up. Also important to make the things that we're trying to get rid of in our body water soluble so that we can flush it out and get rid of it for good, and it just not go to another area onto another cell, right? So we need to take things and break them up and kind of separate that bond between the site, and take the blinders off and get it processed, break it down and get rid of it. So if our body can do that, then it's just more efficient. It's less inflamed, and it has less things coming and going across it that we don't recognize. We want to have our body, our cells recognize what's passing by it, so that if it's something that's foreign and not good for it, it goes, oh, okay, killer T cells. Okay, come into those cells that are on guard, if you will, to protect you and to boost your immune system and support your immune system. If they have blinders on them, they can't see the good and bad passing by them. And that's where things can build up in our body, because it's not the cells, the protector cells aren't seeing, those immunity cells aren't seeing something foreign pass by. They're just not seeing it at all. So the more we can clean up our cellular level in many different ways, this is one supplementation way you can do that. You're just promoting healthier systems being able to do their job. And again, they're for better health. One thing I noticed, I had a fair amount early on in practice because of injuries I had in sports. And the ones that affected me adjusting the most was actually at my right wrist. And so that was one thing that was really helpful in my day-to-day, was just to up my supplementation on top of my good nutrients and water and all the intake for mobility, because I do just have joints that have been injured over time, that just with the amount of repetitive motion we do adjusting affects them. And so this is one thing that I noticed a drastic change in by adding this support into my regimen. So I wanted to share that with you because it's something we have in the office, but we don't always talk about all those things very often unless someone asks us questions about things. And I thought this was an opportunity to show, joint support and overall cellular support, because ultimately it's all things building up in our system creates that inflammation and those pains and aches and degeneration of joints, as well as obviously mobility. So I want to end with just challenging you to think of someone you know. As we're coming into Patient Appreciation Week, this is the time we donate our time to help anybody in our community in need of getting checked, a need of getting their spine checked. So if there's anybody that you know that complains of joint pain or aches or inflammation, or things that are keeping them from doing the things they love, please send them in, have them call the office. And soon we will have up a calendar board of the appointments that are available, but we open up the office for as many new patient appointments as we can for the week of the 24th. And it's just a first come, first serve. Anyone that comes in for those appointments that are referred by any of you, they get to take advantage of our consultation and our entire exam and scan and x-ray process at our expense. So it gives them a chance to find out more about their health, and if there's any of these things that are affecting their joints and their mobility that we can be helping with to support them thriving and living their highest quality of life. So give the office a call and let Jesse know, and we will get them set up for a time that works in their schedule and ours. We look forward to seeing you in the office and hearing your takeaway and hearing who you're going to send in at the end of June to get checked. Thanks so much for joining us, and we will see you next Tuesday. Good night, everybody.